2 months and take the photo today, and we'll go from there.
Okay.
Okay, thanks.
Dr. Mozersky, are you about finished here?
Yes.
We've had several questions and online posts regarding Awake Lipo. Do you have a few minutes before your next appointment to answer these?
You bet, sure.
Great. Okay, the first question comes from one of our recent consults, Dora. She wants to know, how do the risks of Awake Liposuction compare to those of traditional liposuction?
Well, Dora, Awake Liposuction is the safest way you can do it. And the reason is that you breathe for yourself and you're fully aware of anything that may happen in the operating room. So any mishaps can be immediately detected. And although we haven't had any, I certainly don't want to start having them now. So that's why we do it awake rather than asleep.
Okay. Question 2 comes from our longtime patient, Linda E., who has heard a lot about Coolsculpting, Zeltiq, and other non-invasive ways to lose fat. Do these methods work, and if so, what is the advantage of Awake Liposuction?
Some of them do work a little bit, and some of them don't work at all. But the ones that work a little bit don't work enough. And I don't think our patients are happy with the results of those. And we've had the opportunity to do a few that have had that and then redo them and then make them happy. The amount of fat that those procedures can get rid of is really not adequate for most of our patients.
Well, that's good to know. Now, we've been getting a lot of phone calls this month based on our September Awake Lipo special, and several people have asked this question. Are there any age limits in which you cannot do Awake Liposuction?
Age by itself isn't a contraindication to liposuction. Health and other factors are much more important. And so I think that we have many patients that are older, and it depends on their quality of their skin and so many other factors that we can only make a determination. But by itself, age is not a contraindication.
Okay. Last, we've got a question from Susan on Facebook, who wants to know, when you do a fat transfer along with the Awake Lipo, for example, from the tummy to the bottom or to the top of the hands, does the fat establish new blood supply?
Well, Susan, the fat has to establish new blood supply or it won't continue to live. Fat, fortunately, doesn't require much, but it does require some. And blood supply is only one of the factors that's important. Other factors that are important are how you prepare the fat, how you harvest it, what impurities go back into the patient in terms of anesthesia solution and other contaminants that are on the fat. So preparation of the fat and method of transplantation are extremely important factors in fat survival.
Well, I know you have a surgery coming up and need to get prepared. I really thank you, Dr. Mozersky, for taking the time to answer these questions from those interested in Awake Liposuction. I know Susan at Facebook had a few more questions, and I know you'll get to answer her directly on Facebook.
Okay, look forward to it.
In October, Dr. Mozersky will be discussing Dermapen, a non-invasive procedure for facial and body rejuvenation using the latest technology in microneedling. Send your questions to #AskDrMozersky on Facebook, and we'll see you then.